Hey there! Today, let's talk about a topic that might be a bit uncomfortable but is incredibly important. Temporary erectile dysfunction, or ED for short. Now, temporary ED is exactly what it sounds like. Erectile dysfunction that isn't here to stay. It can pop up due to a variety of reasons, and yes, it's as stressful as it sounds, but the good news, it's often treatable. So, what exactly is temporary ED? Well, it's when you can't get or maintain an erection. This could happen all the time or just sometimes, and it can make satisfying sexual activity quite challenging. While ED might sound like a long-term issue, many experience it just situationally or temporarily. For example, maybe you're fine when alone but struggle during intimate moments with a partner. Or perhaps things don't work as well when you're sitting up. It could even be different based on whether you've had a drink or not. The scenarios vary, but the bottom line remains. It's temporary. Now, why does this happen? Stress, lifestyle choices like smoking or lack of exercise, and even psychological factors like anxiety or low self-esteem can trigger temporary ED. It's all about what's going on in your life and your body. And yes, even younger guys in their 20s and 30s can face these issues. It's not just a concern for older men. But what about the causes? There are plenty, from psychological factors like performance anxiety and stress to lifestyle choices like excessive alcohol consumption, yep, the infamous whiskey dick, or even just not being active enough. Poor physical health can lower blood flow everywhere, including areas where you really want it during those intimate moments. And if you're wondering whether it's something more serious, medications or underlying health conditions like diabetes or heart disease could also be culprits. It's always a smart move to chat with a healthcare provider if you're experiencing symptoms of ED. They can help figure out if it's temporary or something more persistent. Now let's talk solutions. Lifestyle tweaks can make a big difference. Cutting down on alcohol, quitting smoking, getting active, all these can help get things back on track. And addressing psychological issues with professional help can also be a game changer. Sometimes just talking about it openly can relieve a ton of pressure. To wrap up, temporary ED isn't uncommon, and acknowledging it is the first step toward resolution. Whether it's making lifestyle changes, seeking medical advice, or dealing with psychological factors, there are plenty of ways to manage and overcome temporary ED. So, take a breath. You've got this. Remember, it's okay to talk about these issues. You're definitely not alone, and handling this head-on is the best way forward. Thanks for tuning in, and I hope this helps you feel more informed and empowered.